Hi, welcome to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity. This is Dr. Daniel Rennell. I'm a plastic surgeon here with my wife Betsy.
Happy New Year!
Happy New Year. And today we wanted to talk about
two things. You've got something you want to talk about, which is breast reduction, and I wanted to ask about, I'm not pregnant, but I know a lot of women who get pregnant wonder how soon after pregnancy can you have plastic surgery? And I asked this because he has that new Tickle Lipo.
Right.
Anyway, so...
I mean, it depends.
What do you want to talk about first?
We can talk about pregnancy first,
all right,
ladies first.
All right,
fine. It depends. After pregnancy, during pregnancy your body changes, it gets bigger, it gets swollen, and so the rule really is to wait until you stop changing.
Right.
You probably won't go back to the pre-pregnancy state.
Never.
A lot of people do.
Never.
Some people do, but
it's
most
rare.
people don't. So I ask patients, are you still changing? And if they haven't, changed in about a month, then they can go ahead and have their procedure. It sort of depends what it is. For example, nursing mothers often, after they stop breastfeeding, they still produce milk for weeks and weeks and perhaps months. And so usually you want to wait until that has diminished.
And you'll know because your boobs are going to shrivel up.
Yeah.
Some don't. My mother's got even bigger, but
yeah.
Anyway, okay.
But no, in general, like Tickle Lipo is really so benign that.
Is that the motherfucker
somebody laughing behind us.
We share
like Marsha.
studio time with the motherfucker who we love,
Yeah.
and then someone's cackling, so we thought that was them. Okay.
So anyway, like Tickle Lipo is benign, it's pretty much benign, and so it can be done.
What about a tummy
pretty soon
tuck?
after. No, that I would
Wait.
really wait until the skin had stopped, and then wait another month after that.
And I mean, like I waited, I've said this on other shows before, I waited after my second child 18 months.
Mm-hmm.
And that was, dieting and slight exercising. I'm not a big exerciser, but, really controlling what I ate and everything. And I knew, and, I just knew, I was like, I'm done. And I had that, sack around the middle of my body, and my breasts just were horrendous. And I was like, these are the things I need.
Right.
And I felt that I had waited long enough. A year and a half.
A bunch of young women who just their collagen gets totally destroyed with pregnancy.
Those babies suck
really,
everything
really
out
good.
of you.
Right.
Yeah, I mean, literally, every way. I mean, my hips have gotten wider, my rib cage has gotten bigger. I mean, that's why women, as they are older, they have these wider tops and these skinny little legs, because we've had pregnancies. So we just turn into these barrels with legs. Even if we're skinny, you still have kind of like a barrel shape.
It's funny, another question I just thought about this that I get asked is, there are people who get Botox regularly. We've talked about this, how you prevent wrinkles from forming, so women in their childbearing years still like to get their Botox, and then if they get pregnant,
it's got to stop.
It's got to stop during the pregnancy because it's never been studied.
Exactly.
But then during breastfeeding,
it's got to be stopped.
They want to know. And the reason it's
I
got to be...
wouldn't touch it.
The reason...
And I love Botox. You listen to the show even once, you know how much I love my Botox.
Right.
I would not touch that stuff as long as you were dealing with that baby.
Remember we were doing that study trying to find Botox in breast milk
in
New York?
He was invited when he was at last year of residency to do a study of breastfeeding mothers and Botox, and I was like, oh my god, thank God, this is great.
And it's actually hard. I never finished the study because I graduated.
Yeah, he graduated and moved
here.
But
the point is, you got to find women who are about to stop, who've decided to stop lactating, and then they have to keep Then I give them Botox, and they have to keep lactating, but into a bottle, into a bottle, and then we'd send it off to. It was the lab in New York was the the lab again. What do you call it? The terrorist lab for weapons of mass destruction, because they're the ones that know how to deal with Botox and body fluids.
Right. That's cool.
So,
anyway, I'm surprised no one has picked up that study or continued it after you left. I think that's a viable. I wouldn't do it here.
Yeah, anybody out there?
We'll do it back in New York.
Fine.
Thank you so much, New Mexico. We'll take our adventuresome nature and we'll put it where it's accepted. Okay. Anyway, so yeah, that's a cool study.
Let's see, what else do
What
I
a filler. I wouldn't touch it, as much as I love it.
Yeah, same thing. It's just because it's not known, and it's probably fine, but you have to do studies to prove it, and so it's not
until it's been proven.
It's not worth trying.
And I don't care what anybody tells you. Right. And so and here's a way to do it. I mean, you want to try and get pregnant, so stop. doing all that stuff until you know you're not pregnant. So like then the week you get your period, go shoot yourself up with everything you need because you know you're not going to get, you know, in the area time frame when you know you're not going to be impregnated, or during your period when you know you're definitely not pregnant, go get yourself your Botox, your filler, whatever you need, then stop. Then you know,
to see if we're pregnant.
Right, exactly. That's how I would do it.
Yeah.
But as long as I had a baby in my body, or was suspicious that I had a baby in my body and was breastfeeding, I'm sorry, your beauty goes. You take care of yourself later. As any mother knows, your stuff comes last.
Right.
Any good mother knows that. Anyway.
Right.
So, all right. So that was my question. I mean, you know, so you say no major surgeries, of course, until a certain time has passed.
Until
I gave myself
shrinking,
18 months.
Mm-hmm.
Which I mean,
and everybody's different. There are very skinny women, for example, who gain 20 pounds,
so jealous.
30 pounds during their pregnancy,
jealous.
and then they don't have any stretch marks, and then they give birth, and they're back to normal.
It's back. I know two people like that.
Right, and so they're candidates for doing things earlier.
Yeah.
So.
Yeah, lucky girls. I am not one of you. So anyway, yeah, no, I thought 18 months was a reasonable amount. So on average, though, because most women are not that fortunate, where they're those little, you know, delicate bird bones and just don't gain weight and lose it, whatever they do.
Yeah, on average, you start looking at 4 to 6 months. 4 to 6 months after delivery, most people have, you know, started to shrink. Now, if somebody has gained a lot of weight, you know, you happen to gain a lot of weight.
I gain a ton.
Right, and so it's got to be longer, but it's very individualized. But I just tell people when they email me how soon, I just say, have you stopped shrinking?
And you know, just come in and yeah, right. You can even just have a consultation.
Absolutely.
With him anyhow. But anyway, or whoever your plastic surgeon is.
Right.
But yeah, I don't know. It's a burning question on my mind, and I wonder how many celebrities have done it. I'm sure many, but like here's a good example. I love Kendra Wilkinson, and she's great, and you know, she's a mom. Her son is now about a year old, a little older than that now. And so I remember back when she had felt she lost all her weight, she was really kept talking about on the show, I'm gonna get lipo, I'm gonna get lipo, I'm gonna get lipo. Turns out she never got it, and she still looks fine, but she never got it. So it was interesting because she, you know, was totally into her body. So I thought that was interesting. Of all people, she didn't end up doing it because she said, I want to have another baby, so what's the point?
Right.
That was, you know, I get that. Anyway, all right, we have to take a break.
All right, we got to wrap things up. Thanks for listening to Talk 1260 KTRC.
We'll be right back.
We'll be right back.